Go.
My next speech is on Bell's palsy. Bell's palsy is a temporary paralysis or weakness of the face. It only happens on one side and affects your 7th cranial nerve, which is your facial nerve. Most Bell's palsy patients will notice weakness on one side of the face or stiffening on that side of the face. When I actually conducted my research on Bell's palsy, it really hit home for me. My dad was diagnosed with Bell's palsy about 4 years ago. Though he's still feeling some of the residual effects, he's pretty much back to normal. His drooping on one side of his face is gone, but he still can't completely shut both of his eyes on demand, and he can't make a complete O with his mouth. What I found interesting was that it said that Bell's palsy occurred through a virus, and but my dad didn't have herpes, the flu, or any virus that causes any diseases. But this just goes to show that it's not just susceptible to people who have these diseases. Intense trauma can also be caused by it. Just watching my dad go through it, I can't imagine not being able to move one side of your face. He's also really lucky that 90 to 95% of the residual effects are gone, and as a result of my dad's condition, I was able to learn a lot more about Bell's palsy. According to the medical information website WebMD, Bell's palsy is a type of paralysis or weakness of the muscles in the face due to the inflammation of the facial or 7th cranial nerve. This condition could strike at any time. However, it is more prominent in people recovering from a viral infection and people with diabetes. Bell's palsy usually affects only one side at a time and rarely reoccurs in the same individual. The original origin of Bell's palsy originated about 200 years ago, and it was named after a man named Sir Charles Bell. He was a surgeon from Scotland who studied the actual 7th cranial nerve, which is your facial nerve. The original cause of Bell's palsy it's said to be caused by an inflammation of the fallopian canal. This inflammation puts pressure on the nerve, compressing it, and the exact cause of it is still unknown, but it's thought to be caused by several conditions, either bacterial or viral infections, autoimmune disorders, a possible relationship to the herpes simplex virus, and it could also have a possible effect on people who have experienced traumatic events such as car accidents or childbirth. It could also be stress-induced. Some common symptoms are eye-related, which are excessive tearing, eye closure, which is either difficult or impossible, or lower eyelid droop. Some other general symptoms are difficulty speaking, drooling, diminished or distorted taste, excess or reduced salivation, pain in or near the ear, or sensitivity to sound. The recovery process, usually about 50% of patients affected with Bell's palsy will have substantially complete recoveries within 3 to 6 months, and about 35% will have moderate recoveries within the next following year. There's a 10 to 20% chance that it could reoccur. Some residual effects that a Bell's palsy patient might have to live with: the eye might appear smaller, the blink is either incomplete or infrequent, the mouth pulls up and outward. You might also have some tearing abnormalities, and also sweating while eating or during exercise. In this conclusion, I would like to talk a little bit about my father's condition. He began to feel the partial face paralysis one morning while eating breakfast. The first thought that went through his mind was that he was having a stroke. By the time he reached the ER, the whole right side of his face was frozen. The doctor was puzzled, so he ran several tests and then was given a 9-day dose of an anti-inflammatory drug called prednisone, and later diagnosed my father with Bell's palsy. For the next few months, my dad had continued ear pain and would have to physically shut his eye to keep it from drying out. He regularly administered drops to keep them moist. After the physical symptoms started to diminish, my father still noticed that he was struggling with fatigue. He would work from 6 a.m. to 2 p.m. and then have to go to bed completely right after. It was later explained to him that this was one of those things that would eventually disappear, but he would have to be patient. It took about 2 years to eliminate his fatigue, and though he still has a few residual effects, he has only significantly improved within the last few years. I believe this is an important condition to learn about because many people believe that they are having a stroke when it is indeed Bell's palsy, so it's good that everybody is informed about it. Regardless, any stroke-like symptoms should be taken seriously and immediately attended to. Thank you.